as the live stream goes on. This is probably the largest gathering of the Health and Wellbeing Board that we've had, certainly since I've been co-chair, so welcome everybody. For colleagues, I think most of us now will be used to virtual meetings, but not necessarily always on Google Meet. The person that is speaking is the person that is in the streamed recording and goes out to the YouTube channel. So it's really important that people keep their microphones off until I call you as chair, otherwise you'll suddenly appear possibly in the live stream. There is a grid view. For me, that is 16 by 16. So I won't be able to see everyone, as there's 21 people on the meeting call this afternoon. So one of the other challenges of Google Meet is it doesn't have a hand function. So please, if you can't put your hand up and see me to speak, do put that you want to come in the chat. What we always say is that we avoid using the chat for a side commentary, as we wouldn't do that in a normal public meeting in public. I've got timings, as we've got a packed agenda to try and hold people to. Obviously, the meeting is being recorded and live streamed. Was there anything else there in terms of committee guidance, meeting guidance that you would want to add, Peter?
No, Chair, I think that covers everything. Thank you.
Thank you. We've been working really hard to reconstitute and repurpose the Health and Wellbeing Board. So one of the reasons that so many people are here is because of that work, wanting to ensure that we've got health in all policies, and that's also why we're seeing policies come here from diverse parts of the council. And also widening the remit and the redefining and widening the remit, and also the membership. So thank you very much, as I say, for attending, and everyone that's come forward this afternoon. In terms of apologies absence, Peter, you did notify me of, I think, Laura's apologies earlier this afternoon, but do we have any others?
I have received no other apologies, Chair.
Okay. Do we have any other apologies this afternoon? If there are any, please do use the chat. One thing I also wanted to highlight is that we've got non-board members attending, which I obviously welcome. So on the item that the City and Hackney Adult Safeguarding Board is obviously bringing forward, we've got Dr. Adi Cooper and Raina Griffiths. We've also got colleagues from Hackney Council's planning team for the Child Friendly Places work, which is Gabrielle Abedi and Carol Gubchek. From the Council's Parks and Green Spaces team, Sam Parry presenting on the Parks and Green Spaces strategy, as well as wider City and Hackney public health colleagues in Chris Lovett and Amy Wilkinson. There are no new members this afternoon, but there are in the agenda pack on membership, outlining some extended membership for the Health and Wellbeing Board after the discussion at September meeting. We're going to formally invite these new members to the January Health and Wellbeing Board meeting as well. So unless there's anything else on introductions, I've obviously seen some of the pop-ups in chat, but I think they look like they're fairly self-explanatory. So thanks to Gabrielle. Liz is obviously joining us too. And I hope that someone can ensure that Chris and Jake have access to the agenda. I can also, I will rely on somebody other than me to achieve that aim, if that's okay. Declarations are of interest that aren't already recorded. I can't see any. Okay. Minutes of the previous meeting. Do we have any comments or clarifications on that? Do people actually have sight of them? I appreciate a few colleagues are struggling with access and technology. We're happy to agree the minutes. There's obviously the action tracker beyond that.
Yeah, I'm happy, Chair.
Yeah.
Thank you. Bear with me 1 second. Great. So on to the actions log. There are 2 supporting papers for the action 1 and 4 in the log, which are already in the agenda pack. Colleagues have added a separate tab for added actions that are for individuals and not board actions. I think that's something that came up at previous meetings. So there is the VCS resilience strategy update paper for progress on action 1, and then that expanded health and wellbeing board membership paper in terms of action 4. Did anyone have any comments or queries in terms of the action tracker? No, we're happy to. I just want to pay tribute for the work that's gone into this, and indeed the minutes, and ensuring that we've got a very clear action tracker. And I think it was you, Mark, that suggested adopting this methodology from the ICB, and I think it's really positive. I think we can see the progress that the board is making. So thank you again to colleagues that have ensured that that happens. So unless someone jumps in, I can't see anyone indicating either in the chat or in person, I will take it as read that we're happy with the actions that have been agreed.
Yep, happy with that.
Yeah.
Thank you. So item 6 was going to be the community voice item, and there's also opportunities at this point in the agenda to ask questions from a member of the public. There was a question from the member of the public that was received after the notification time, so I've agreed to take that forward as casework in the Mayor's office, and I think there's just been a challenge of getting the community voice organised this month, so that's going to be rolled forward, I think, to the January agenda item. Is that correct? I'm looking at Health Watch colleagues. Yeah, Ben's nodding. Malcolm, sorry, is nodding. Okay, so that gives us a bit more time, but there's still quite a lot on the agenda. I'm then going to hand over to Sandra for a sort of COVID-19 verbal update. I think we've had this common across the major public-facing boards that the council and the health system are involved in, and obviously there's a great deal of interest. So, Sandra.
Thank you, Chair. To preserve my voice, Diana, if I was going to do the update.
I'm happy to do the update for Sandra. I'm going to share my screen with you rather than verbally. I think always helps to have a bit of a visual in front of you.
Thank you.
Okay, no worries. Just waiting for the technology to work. Okay. So for this COVID-19 presentation, I will be focusing more on the service uptake. So by that, I refer to the NHS Test and Trace. Briefly about the situation in Hackney. So the incidence rates have been reducing over the past 2 weeks, as well as testing rates and the positivity rates. However, this is only a short period of time, and it is too early to say whether there's an actual trend. And you can see from the charts that I'm presenting on the slide and on the left, that for all of the three indicators that I've just mentioned, the top one being the cases per 100,000, the middle one being the testing rate, and the bottom one being the positivity rates. That's how many tests are coming up positive in each, what proportion of tests are coming up positive, should I say, in each 100 tests performed. All of these indicators have been rising since about September time. So just to reiterate, it's a bit too early to say whether the recent reduction is a trend. So we are observing those carefully. The testing, so how our residents uptake the testing for COVID-19, while testing rates, they generally increase with age, the positivity rates actually don't follow the same patterns. And what I mean by that people do tend to test more among older age groups. But when you look at how many what proportion of tests do come out positive, we see that actually younger age groups, they have quite high positivity rates compared with, say, people between ages of 30 and 59. And then again, a rise among those aged 60 and over. When we look at the ethnicity and how people tend to uptake testing for COVID based on their ethnic background, we can see that significantly high proportion of tests are performed among white residents, and these are rates per 100,000 population. So it's not just the number of tests by each of the ethnic group, but rather it's presented per 100,000 population. Significant differences between each of these groups. However, when you look at again at the positivity of tests, then there isn't such a great difference between white, Asian, and Black residents. However, those that identify themselves as other ethnic group, they have the highest positivity rates at over 14%. It is no secret that we did have a large outbreak in the north of the borough, and in particular, Haredi community was affected. We can't say from these data whether other does represent that community because we just don't have that level of granularity. But we do know that there is the rates continue to be among the highest in the north of Hackney. When we looked at how testing rates differed by different deprivation levels, area deprivation levels, we can see that there isn't much difference between the most deprived areas and the least deprived areas in terms of testing rates. However, there's definitely a significant difference in positivity rates, whereby people who live in more deprived areas tend to contract virus more frequently. So the more of them have positive tests. High proportion of them have positive tests compared to residents who live in areas which are more affluent. So I'm just really rushing through this because I know I only have 5 minutes. And of course, after introducing the local test and trace service, we are happy to say that the success rates of contacting people who have been tested positive has increased. And that has increased from 73% that we've seen before the service was introduced to about 80% since the service was introduced, which is a national target. But we do see differences among different population groups on how well they engage with the service. So we know that residents who are older tend to engage less, so they don't respond very well to the calls, and that they a high proportion of those contacts tends to fail on follow-up. We also know that some of the ethnic groups we are less successful with residents from some of the ethnic groups. However, we do have a very high proportion of those cases with a no ethnicity, and these are the ones that are least likely to engage with the service. I also have to say that there's still some improvement to be made within the service, and that's not necessarily a local one, but also the national service, because it still takes quite a while between becoming symptomatic, taking the test, and then being contacted by contact tracer, with the latter having actually the being the bigger gap, or about on average of 4.5 days in Hackney. We also see that depending on where a person lives, how well they're engaging with the test and trace service, and the high success rates we see in Dalston, about 75%, while the lowest success rates are in Hoxton. And among those wards that see actually the highest numbers of COVID-19 cases, and seen the highest numbers of COVID-19 cases throughout the pandemic, and these are the Springfield, Cazenove, and Stamford Hill West wards. So they fall among the lowest in terms of how successful test and trace are with these residents. And the key messages from this presentation. So it does say that I've presented something in the previous, I guess, in the very first Health and Wellbeing Board in summer, we did present data on how COVID-19 affected people in terms of inequalities, and how it really has impacted on the most vulnerable in our community the most. And the pandemic obviously goes way beyond the health outcomes, and it also impacts on mental health, on finance, on job security, and service utilization. So what I've presented to you today is engagement with the test and trace service, and we see from that not all of the population groups within Hackney engage equally well, and there's definitely some room for improvement. And we are engaging with community leaders and religious leaders to improve on that. And what else did I want to mention about? Yes, just a last point, really, that infection control measures could be more effective if people follow the guidance around self-isolation, and if we manage to reduce that time between experiencing symptoms and successfully isolating. That's it. I'll take questions if there are any.
Thanks, Maya. Could you stop sharing the screen? And then I will see if there are any questions or comments. I've got Councillor Kennedy.
Thank you, Diana. I just wondered, are we at a point now where we can share our test and trace data on a regular basis via our website?
We can start adding, we can start adding, I guess, the success rates, if that's the kind of information that would be helpful. We could definitely supplement our existing public dashboards with that. And I will drop the link to the Hackney coronavirus data page within the chat box for people to access.
Yeah, I think that would be really helpful, Chair, if we were able to share that, because it presents a narrative around the extra value-added work that our local calling is doing.
I tend to agree. I think there is some work happening on a dashboard that the analytics team are looking at, and I suppose for colleagues that maybe don't look as religiously as I do at that data page on the council website, it's an incredible amount of work that goes into that, and I really do value as well now the dates being put up when the last update was made and when the future update is due. As you go down the different data sets, I think it provides a really good snapshot of where we are today, but also where we've been. And there's some, superficially positive information in there, but obviously still some of the significant challenges that underline the presentation that we've just seen. Deputy Mayor Bramble, and then I think I've got Councillor Williams.
Thank you, Chair. Just thank you for the information. All of that was quite helpful. I really agree with what Councillor Kennedy said, that information will be really helpful in the public domain. just going back to that graph, looking at the contact rate, I noticed in some boroughs, I think the top borough is 75% contact, and some of the lower boroughs was about 26. But I wanted to know if that was that you're able to get hold of people in those areas a lot better, or is it to do with the amount of cases in different areas? Would that have an impact on the contact rate? So I don't know if that comment's clear. So I'm trying to understand if you're nodding. So
Yes.
because context is powerful. So is it that in those areas we can't get hold of people, or is it lower as well because there's lower cases in those areas? So just a bit more context on that would be really helpful.
Yeah, so some of these numbers are based on very small numbers, because when you start disaggregating to the ward level, then they become smaller and smaller. And say if there were 4 cases and 2 have been followed up successfully, you've got 50% success rate, which it may not be exactly a reflection of how well we're following up with people. But I would like to mention on that thing about whether in areas of a lot of cases we are following up a lot of people, not necessarily. And that's seen from the Stamford Hill, Cazenove and Springfield case specifically. So in those wards, the follow-up is only about 35%, around 40%, I will say, because yes, I can share later the data with you. But that is based on actually a lot of numbers, because the total number of all the cases that have been transferred to the test and trace, these wards account for 52% of all the cases that have been transferred. That just tells you the scope of how many there are. And despite that high number, the engagement is not.
Thank you, Chair. If I may, just a follow-up comment or question or query. How complicated or straightforward would it be then if we're putting that information on the website to have it per capita per ward? Otherwise, you could really look at that information and make a judgment about different parts of the community or the borough in terms of who you're able to get hold of, where and why. And I just wondered if a bit of context on the amount of people that have been tested positive in that area against who they've been able to contact.
Yeah, so currently we present data in rates as well as absolute numbers. That's what you've got on coronavirus data page. But I agree, I think for the public, a slightly simplified view of numbers is needed. So I was proposing to include maybe one in how many residents are affected by this. So just one additional line.
I think that context will be really, really helpful to get a true picture. And thank you, Chair, for your patience.
Okay, Chair, could I just add that it's the numbers or the statistics themselves will tell part of the story, but actually the reasons why we can or can't contact people are quite complex, and that requires quite a lot of narrative to understand. So it's not just a question of the incidence rate in a particular area, or even the prevalence of a particular community living in a particular area. That gives you the understanding of why we could follow up people there and where we couldn't. So I think although it will be informative to put this information into the dashboard, there's also quite a lot of narrative description that needs to go with it, certainly for our use internally, to understand why people do or don't engage effectively, whether it's with NHS test and trace or with our local contact tracing system, or whether it's simply that we haven't got all of the information necessary to contact them. And that's one of the things, one of the ways that we're trying to address that is by working with our community champions, and both in terms of getting them to engage with the community to understand how to work with test and trace, but also to be our ears and eyes on the ground and help us to understand what's going on.
I think that's really important. Thank you. Councillor Williams.
Thank you, Chair, and thank you, Dana, for the presentation. And Dr. Husbands, it was really probably a question around what you were just outlining there and the reasons why there is high contact rates in some parts. of the borough compared to other parts, what we know about that and how we can interrogate that a little bit further, so that we can improve those contact rates, and also just trying to understand the layers of reasonings. So Diana, you did talk about inequality across ethnic minority groups. He also talks about poverty, but just trying to understand what the other factors might be, and where we as a partnership certainly have control of those factors, where we might be able to increase them. I wonder if you could just kind of address that a little bit, please.
I can give you some kind of general, kind of high-level reasons that we know about already, which why people don't self-isolate or they don't engage with contact tracing. And there's some of the things that you could probably imagine anyway, that they are concerned about money, that they're concerned about the impact on their employment from taking the time off, that they're concerned about other things like getting their children to school and things like that. And so they're just they just have a number of concerns that are just, you know, their normal life concerns that are not addressed by the system that's set up around test and trace. And even with the £500 isolation payments, not everybody qualifies for them. You know, you have to be in receipt of certain benefits in order to qualify, and not everybody who is on a low income is in receipt of those benefits. And also, you know, that we've now got to this stage in the year where a lot of people have already had 1 or 2 periods of isolation, and so they're beginning to feel like they're pushing it, saying to their boss that they have to self-isolate again. So there are a whole load of rather complex reasons, and I can't say for sure what applies to any particular individuals, families or communities in Hackney, but we are both gathering soft intelligence but also doing some behavioural insight work, which is just beginning, in fact, so that we can gather more information about that, and then develop some strategies to help overcome the barriers so that people can self-isolate, because it is really important that they have the support, that they know that they can self-isolate, that it's not going to cost them their job or whatever, and that they can self-isolate so that we can break the chain of transmission. Otherwise, we're going to be in this endless cycle.
Thank you. Jake's put a useful report in the chat. I don't know if anyone else has any other comments or questions on this item, conscious of time. No. Question, Malcolm.
Yeah, simply, can you, Sandra, can you just clarify whether details of people's ethnic background is now being routine collected for all people who are part of the either going to be tested or part of the test and trace system?
Ethnic category is one of the data categories in the routine data collection, but it's not necessarily collected very well. We do know that the completion of all of the personal information about people who engage with test and trace is it's not consistently good, and that often the data that we're getting from test and trace, you know, about any particular individual is not as complete as it could be. And one of the categories that is not very well completed is ethnicity.
Thank you very much.
Yeah, and we've consistently returned to the question of other, which I think comes across very clearly in that presentation. Okay, I'm going to move us on. Thank you very much for that presentation, and I just urge colleagues and guests to look at the data set that is live on the council's website, as I said, because it's a fascinating thing to engage with, as well as these more detailed presentations. And we've sought to continually evolve that and be as transparent as we can be. And I'm really proud of what the work the team has done, and I think we're seen as some of the best at that, certainly locally in London. I'm going to hand now item 8 over to Chris and the Health and Wellbeing Strategy update. It was a supplementary, I think, dispatch but it is there in the agenda pack that everyone should be able to have access to. So remind you, Chris, we've got about 10 minutes in total for presentation and discussion in an ideal world. So I hand it to you.
Thank you. So I think, do you want me to share the screen? Would that assist?
If it assists, yeah.
Okay, let me. It just disappeared. I'll start talking and try and multitask, which may be a mistake. Is that viewable now, colleagues?
Yep.
Yep, great. So this is a report that gives an update on the process that we are adopting to develop the new health and wellbeing strategy. I'm not going to go through the report in full detail. Essentially, the last health and wellbeing report, last health and wellbeing meeting, we did agree the approach that we would want to take to developing the strategy, and that was to look at using the health inequalities lens to focus the work. This essentially is giving an update following that meeting and looking at how the health inequalities steering group has now been established to provide that focal point for the work to be undertaken. And then what we are looking to do in this report is set out the development working group that would be looking to take forward the strategy. It gives an indication of the proposed membership that we have bringing forward for your approval, so that this is going to be the working group to develop the strategy. The paper also talks about how we would be looking at defining the draft priorities, and then very importantly, how we would undertake the stakeholder and resident participation engagement with communities as well. We've also got a timeline here, and we are looking simultaneously, as well as the Hackney Joint Health and Wellbeing Strategy, to refresh the City of London strategy as well. As people will be aware, we're a joint public health team. These are be very much separate strategies, but they are taking a similar approach. In the Corporation of London, we had a engagement session with members, and one of the questions we asked them is whether they wanted to align the development timelines, and they have indicated that they do wish to do that. And that would potentially give us some opportunities to do some joint engagement where it makes sense, and potentially align some of our data analysis, very much focusing as much as we can on wards or lower super output areas, but certainly looking to see whether there is some alignment that we can do, but recognizing these are going to be very clearly strategies that will need to integrate themselves across the work of the corporation and the council separately. So in terms of what we're asking you to consider is endorse the membership and endorse the proposed process for developing the strategy.
Thanks, Chris. I just wanted to just highlight, it's a year-long piece of work going by that timeline to colleagues. So this is going to be an in-depth process, and obviously it will involve a great deal of onward engagement above and beyond what happens here, obviously at the board and with this working group. I think Mark and I did touch on the alignment with the city earlier today, and just how we want to approach that, and whether there are some meetings of the board or in common at some points in the year, while recognising that some of the challenges that regular attendees at the ICB will sort of see, the challenge of making sure that the city's distinct identity obviously is recognised. And as we can see from the agenda this afternoon, we've got a lot of Hackney policies and strategies coming forward, so we need to make sure that we recognise the distinctiveness while doing some joint work, as Chris has suggested. Could you stop presenting, Chris, if that's okay? I know the timeline's quite a useful thing to see in the membership, but just in terms of seeing hands up. And Sandra's point in the chat is obviously very valid about the ongoing work in pandemic response. Any questions or comments? John.
Thank you. Yeah, it's a really good paper and really very pleased to see it. So very supportive of it. Just a couple of comments. In terms of kind of me or Jamal supporting this activity, I probably would say Jamal, but unfortunately he's leaving us to go to the CQC. So for the present, it'll be me until we replace Jamal. The other point is about the co-production chart. I'm very pleased it's mentioned and highlighted in the report. However, we're conscious that we need to do a revision of it in terms of making sure that we can include the voluntary sector better and also frontline workers. So with that kind of caveat to the co-production charter, very supportive of this approach. Thanks.
Chris.
Thank you. I mean, noted. And just in the chat, I think we have we're indicating obviously that the pandemic response is going to go on for quite a long time, even with the welcome developments that we have of potentially the vaccine coming. So I think just in terms of timelines, it does enable us also to build in a little bit of expediency, obviously, to respond to the pandemic. And I think the other thing in terms of responding to the pandemic, it is going to have a significant impact on health inequalities. We know that. And the period up to November would also allow us to get some more of those findings that are coming through about the impact of the pandemic. And certainly there's likely to be, I think, differential uptake of the vaccine and other measures, as we always know that is usually the case. So I think if there is any further comments on the group membership, we'd be very happy to take those on board. But we are looking, I think, to make sure that it does try to square the circle of having sufficient breadth of people, but also being focused enough so that we can get on with the business of developing the strategy. And obviously, we'll be bringing back updates to the Health and Wellbeing Board for people's consideration, and then obviously the final report at the end of that process.
Thanks, Chris. Just picking up John's point, obviously there's a good breadth of sort of statutory players in there, including, I'm afraid I'm including Healthwatch and HCVS in that blanket, but co-production also has to think about the sort of service user and the resident beyond, and I think we just need to make sure that is touched on, because sometimes when sectors talk about co-production, it can get captured before it goes beyond that to the service user and the resident. So I think that's an important strand to be aware of. Any questions or comments? Some nodding, which is good. Well, I've got a great piece of work, something that, as has been said, is going to be occupying the board and the working group for the next year, on top of the very much the day job of the pandemic. And I think we'll maybe consider as co-chairs and the team how we address that interface with the city about the work of the board as well as the work on the strategic development. But I think other than that, are we happy to endorse the timeline and
yes, can I just make a comment, Chair? It's Mark.
Yeah, absolutely.
Just in terms of, I can appreciate the timeline and doing it thoroughly and taking this long. So I'm not suggesting that's not the case, but nonetheless, you do sense it'd be great to benefit from the learning as we go along as well, to inform our work, between now and when this is finished in November. Because I mean, and how we actually capture that in a kind of action learning sort of way. Our work will inform it, but it can inform us as we go along. Obviously, that would be the case, but it's just we'll need to weave that into how we organise this agenda going forward, so that we can benefit it as we go along as much as possible. And I just like to make sure we see that happening.
Yeah, I think that's a very important point, Mark, and that's the sort of interim reports that we'll be bringing to give you a progress update. I think there will be obviously some pieces of work that will be quite discrete, things like a literature review, some of the early findings from the consultation. Yeah. And we're very much committed to ensuring that they're shared amongst the partners. I'm sure there will be learning, not just in developing a strategy, but also for other strategies that the council and partners are looking at, but also in terms of other work that may be being undertaken across Hackney as well as the city.
Yeah, great, thank you.
Are we content? Great.
Content.
Sure, that's not the technical term, but it will do. Thank you, Chris. Item 9 is the Healthwatch Complaint Charter update, and Malcolm's already put in the chat that he'd like to come in, but obviously John is presenting similar length of time, and I think this is something you've asked for previously as Healthwatch that we're all really aware of, both here and in other places. I think I've seen it referred to as well in other dispatches, but I'll hand it to John.
Thank you. I'll do an introduction and Malcolm will join me then. So this is a report coming back from the last meeting in September where we said we'll review and review the implementation of the complaints charter, but also the extension of it as well to other groups operating within Hackney. So in terms of the review, we wrote to all the signatories after the last meeting and had replies from everybody. The reply from the pharmacy was came after the report was completed, but I'll mention that a bit more as I go through the paper. So essentially the aim was basically to kind of make sure that people were kind of publicising the charter, making sure that it was kind of promoted throughout their complaints process, and all patients and it says patients and users with get the complaint charter in their complaint pack so they understand the commitments that they're demonstrating. I have to say, generally we were pleased with the responses. There's clearly a kind of lot of activity and a lot of support for the charter. I think one of the challenges we've seen is that not everybody has been receiving the complaints charter, and we do urge that all signatories send it to them because it's a key bit of document. And for us, it's really about helping people really understand complaints and making sure they make effective complaints, because any system will learn from that process. So I think in terms of kind of the City and Hackney Local Pharmacy Committee, like I said, we weren't able to get a reply for this report, but we did have an exchange of emails this last week, and we're going to be supporting them to actually kind of promote the charter across the community pharmacies again. And I think it's kind of, that's what we want to do with all the partners at the moment around this review, make sure that everything's working well. I mean, certainly it's working better in some places than others, and we appreciate some of the challenges people have had this year, particularly around the pandemic and the way that, essentially complaints got closed down for a while. So we're willing to, absolutely willing to work with people more on this, and thank their support that they've provided already. We do think it's important to kind of see this as an inequalities intervention as well. It's really about kind of really sending a strong signal to the residents that their complaints are valued and seen as an important way to improve services. So I think it's really important that we do continue to promote this, and we kind of think about how we promote it. And that's why the extension of this report, these charter rather, is so important. I'll leave Malcolm to say more about that really, but I mean, I think it's important that we've had engagement with both the GPs, the opticians, and the dental committees, and so we're really pleased about how that's proceeding, and that we're likely to extend the charter very soon. And as I said, the main point really is this: is for you to note this report, and we will support all the signatories to make sure they effectively implement the charter. I'll pass it across to Malcolm now, who will say more about the extension of the charter.
Good, thank you. Yeah, couple of things. One is, evidence that complaints really bring about service improvement and that it's enduring is really of fundamental importance here. And we have had some really good evidence from some of these signatories to that effect. Really important thing just recently has been, after some considerable time, general practitioners, the local medical committee has agreed to sign the charter. And that's happened very recently, so that's very good news. And we are redesigning the charter very, very slightly to bring in some of the things that they were concerned about, mostly about the fact that quite small practices might have some difficulty in really sort of carrying out some of the tasks that are described in the charter. For example, service improvement. That's one of the issues that was concerning them. Working with the dentists and the opticians has been perhaps a little more difficult. Dentists have been quite resistant, but now they've invited me to speak to the next meeting of the local dental committee in December, and I think that'll be a very good opportunity to explain in more detail why the charter is not about replacing regulations, but it's about ensuring access and, if you like, simplicity, so that people know how to use the complaints process without being overwhelmed by it. With the opticians, they've shown a very sort of positive approach, and also they're rather concerned about the pressures that it might bring on them. But again, we've reassured them that this is not about greater pressure, it's about greater access. I'm hoping that quite soon, within a couple of months probably, we would ensure that all providers of health and social care in Hackney will be signed up for that. And one other thing is that we had designed, I suppose slightly redesigned the charter for the London Borough of Hackney, which they had specifically asked for, and that document is now complete. So I think really good progress, and thank you everybody.
Thanks, Malcolm and John. I do have two questions, but so indicate if colleagues want to come in. My first question was to sort of join Malcolm together. How common is such a comprehensive charter and engagement compared to other health watches in London, our peers? And my second question, obviously increasingly with our work with the voluntary sector, there are blurred lines in service delivery around sort of health and social care, and what work is going on to think about where those actors are effectively supplying health and social care to our residents, and how does it sit with the commissioner, the complaints process, or internally there? And I'll take my chair and mayor hat off. I'm a board member of the Shoreditch Trust, and I know that they're reflecting on what they're calling a kind of customer complaints charter that they're developing themselves. And I don't know whether it's inspired by this sort of discussion or something they've just become aware of as they provide more, and I hate the word customer-facing services.
Yes, I don't know. I think as far as the first, let me spin over the first question, which is, I mean, I don't think the model we've used has been widely disseminated across London. It has been adopted by the London Ambulance Service, interestingly, but as far as I know, other health watches across London have not adopted the charter. And I think having a charter which brings all health and social care organisations together, albeit there are clearly some exclusions that you referred to, has been a really important step forward. Maybe John, maybe you could deal with the second half.
Well, first, just comment on the charter issue. I think it's something about Hackney, to be honest. That's there's the way the system works together here is much more kind of collegiate, I would say, than some other areas, perhaps. So maybe that's been overcritical of other areas. But I do find that one of the things is there's been, certainly since I've worked here, a general commitment to about kind of be seen to work together. And I think this is where the motivation for signing charters comes from, because it's a desire to actually kind of demonstrate to the wider public that, we're a system that wants to work together for the people of Hackney. And I think that's what's kind of, I mean, I'm not saying that other areas don't do that, but it seems much more siloed in other areas. And I think this is why we're able to get charters going more effectively. In terms of kind of the voluntary sector, I do think it's in the nature of the voluntary sector that their complaints kind of stop within their organisations, and we would like a conversation with them about how this operates and how people can feel more confident in that process. For example, I mean, one thing that the Health Watch Hackney does is essentially that it doesn't stop within our organisation. If somebody wants to make a complaint to us, we direct them off to London Borough of Hackney, and that they will go through that process to make a complaint about it. So we think there should be always somewhere where somebody can complain about an organisation above them. And I'm not quite sure whether the voluntary sector are on there. I mean, it'd be interesting. I know Jake and Alistair are here today, and it would be useful to see what their views are on that. But we would certainly be very up for talking to HCVS about whether we could actually kind of include the voluntary sector within this complaints charter, because then that's for me, that's kind of slightly the missing link that I'm not quite sure how we would fit into this.
Thanks. Just for reasons of time, I think Jake really welcomes that in the chat, and that conversation can obviously jump off from the meeting. I think we're noting the progress made and really welcoming that commitment. I think you put it really well, John, that the system takes this really seriously, and I think that is incredibly important. And thanks, Jake, for the comment. So if we're happy to note that, we'll move on to the next agenda item, which is item 10, Growing Up in Hackney, the child-friendly STB plan, which Lizzie, Gabrielle and Carol, I think, are going to speak to. There's 15 minutes odd for the presentation, but if you can do it quicker, that's obviously welcome, and then we'll have 10 minutes for the discussion.
Yeah, is my screen presenting?
Absolutely.
Yeah, if you just go maybe view entire screen, just to make it bigger. Oh, great. Has that happened? Sort of, kind of, yeah. we'll go with that. Thank you very much for giving us the opportunity to come and talk about the Growing Up in Hackney, Child-Friendly Places supplementary planning document. Yeah, we're both, me and Gabby are both from the strategic planning team, and we'll both just kind of, I'll give a bit of context. Gabby will give an overview of the principles and the guidelines and what's in the document, and then we'll just kind of wrap up with what sort of the key lines of inquiry and what would be useful to have feedback from in terms of this board. Yeah, so just to say, we launched the draft supplementary planning document on the 27th of October for consultation, and that's going to run until the 12th of January. And that's public consultation, and we are really looking to get feedback on the draft SPD. It's been about a year that we've been developing the SPD, and that's through working a lot with internal services, because it does draw on a wide range of services, but then also making sure that we engage young people in that process as well, and we'll talk a little bit more about that as well. And really just to say, the overarching sort of aim of this piece of work is to ensure that the built environment is designed, planned and maintained to provide young people with equal opportunity to access and connect with nature, play and move around independently in a safe and healthy neighbourhood. And that's kind of, yeah, the overarching sort of aims. And then just to go on to the next slide. So just in terms of how this sits within sort of the planning policy framework and the position that it has. So this work very much builds on the adoption of Hackney's local plan, which sets LP33, which was adopted in July of this year, and it sets the future growth and regeneration in Hackney over the next 15 years, and the child-friendly SPD will help set the policy context with a particular child-friendly focus. And I think it's just, just worth saying that this really is about, through establishing child-friendly principles and design guidelines for the built environment, we can ensure that proposed developments and the design process accommodates and actively plans for people of all ages, abilities and backgrounds, and that child-friendly design and urban planning goes beyond designing kind of playground provision and towards shaping the physical features around and between buildings and neighbourhoods as a whole, to become multifunctional, inclusive and welcoming for everyone. And I think, yeah, if we just go on to the next slide. I mean, the supplementary planning document will have weight in terms of once it's adopted, which we anticipate will be sort of spring of next year, and it will have be material consideration in any planning decisions. And I think we just wanted to touch on the sort of process that has led us to the development of the guidance, and we've it was really important that young people were involved in the development of the principles that Gabby will talk through in a bit more detail, and also the guidelines. And we drew heavily on a really significant piece of work that the council has done over the last year, which was the Hackney Young Futures Commission, which I think it spoke to over 2,400 young people in Hackney to get their views on what the key issues are in the borough. And it's been really fortunate that we could draw on a lot of the recommendations. Actually, I think there was a session coming up on Saturday, I think, where the recommendations are going to be presented and sort of the next steps in terms of that project. So that's helped us a lot in identifying what some of the issues are. And then we also held 3 sessions with Hackney Youth Parliament, which really looked at developing the principles and guidelines in more detail, and then fed into this piece of work. So I think just to go on to the next slide. So I think, yeah, Gabby's going to pick up and just talk through. We just wanted to give a sort of overview of the principles and the guidelines, and a bit of what is in the actual draft document, and then yeah, we can touch on a bit more about what would be useful to have your input into as well.
Yeah, so hi, and the document is formed of 6 parts. Part 1 introduces a framework that documents purpose and vision for a child-friendly built environment in Hackney. Part 2 outlines research and guidance documents that support the SPD, its development to date, drawing from international to local context. And Part 3 introduces the key child-friendly principles for Hackney's built environment. Part 4 is the technical design guidelines. Part 5 outlines engagement guidelines and best practice case study examples. And finally, Part 6 sets out the tools needed to support the implementation, delivery and monitoring of the child-friendly design guidelines. Our public consultation, and therefore this presentation, will focus on sections 3 to 6. However, at the end of this presentation, I'll point to our dedicated webpage where you can find more information on every section, and you can read the document in full and have the opportunity to join in our public consultation. The proposed child-friendly principles collectively set out the vision for a built environment, as Lizzie mentioned, supporting health, well-being, happiness and prosperity for all children and young people in the borough. The principles are specific to Hackney. As was mentioned, they're a direct outcome of workshops held with members of Youth Parliament, delivered by ZCD architects, and also the principles were further developed following recommendations from Young Futures Commission report that came out July 2020. I mean, the principles are listed here. They are shaping my borough, doorstep play, play on the way, people before cars, contact of nature, places for all, making spaces children and young people want to be in, and health and well-being. The principles, in summary, focus on improving opportunities for children and young people to connect with other people of different ages, to green spaces, to be able to move around independently and safely in clean and welcoming environments. Chapter 4 of the SPD details the technical design guidelines that will supplement the new borough-wide local plan policies that relate to achieving child-friendly spaces. Children and young people, it's an important focus as they move through and they experience their built environment at a different range, scale, tempo and pace than adult counterparts. So it's really important to have a toolkit that provides this alternative lens to designing spaces and assessing planning applications and decisions. So the design guidelines are divided into a 3-part neighbourhood play scale that children and young people grow up and move along in Hackney, and that's the doorstep, streets and destinations. The guidelines are then supported by best practice case studies, which help to illustrate aspirational design guidelines, design and schemes. The guidelines, this section will be used as a tool to support and inform plans, designs and maintenance of public space. And the design guidelines themselves are about 20 pages long. So we've put together a short summary of some of the topics and case studies that are covered in this section. Firstly, the doorstep. As has been highlighted by the current pandemic, the spaces at the scale of the immediate doorstep are vital, in particular to children and young people and their carers, because they provide the greatest opportunity to encourage the gradual increase in independent mobility, confidence and opportunities for social interactions. Some of the subtopic categories within this design scale are listed on the slide. And they aim to, for example, support children to have places to play and be active directly outside their front door, irrespective of the type of home they live in. The design of King's Crescent Estate phases 1 and 2, which was completed in 2017, is one of our key case studies because of the social and play value of the doorstep and quality of surrounding public realm being a primary consideration in the early stages of the design. This street scale is important because they are the places where walking, cycling and bus use are encouraged, and these are the most accessible means of transport for children, young people and their carers. It's really important that the design of streets and routes are designed with child-friendly principles in mind in order to support the safe and independent mobility of of these spaces, and to make streets more attractive and comfortable places to move through. Again, the sub guideline categories within the scale are listed on the slide, and they aim to, for example, support the greater access to and contact with nature in everyday settings when moving through the borough, and to support the reduced proximity to polluting sources. I'm sure you're all familiar with school streets. These are a number. What is one of the case studies covered in this section of guidelines. It's a pioneering scheme, and it's such schemes that really help to demonstrate how Hackney is already leading and becoming a more child-friendly borough by placing the lived experiences, and the health of people before cars. And the final scale, that is the destinations, includes places such as parks, playgrounds, spaces around schools, and areas in front of shops in the high street. This scale focus is important because such places must be designed to be safe, convenient, and welcoming for children and young people from a whole range of backgrounds and identities, providing opportunities for informal and formal play, intergenerational dialogue, rest, and socializing. The sub-topic categories in this guidance scale are listed on the slide and aim to, for example, support children and young people to have more opportunities for intergenerational experiences in public realm in their neighbourhoods, and to feel greater equity and ownership in public spaces. One of the case studies supporting this guideline is Gillette Square, because of the adaptable and community-orientated environment offered through the space's versatile design. And we're really keen to champion the much-loved and highly valued community asset that's Moogers and Sports Cages. We've drawn on both national and international precedents, as here on the slide shows, Israel Plaids and Copenhagen, to support guidelines referring to the robust design and material specifications for cages. Finally, we have Chapter 5 of the SBD draft, which outlines guidelines of best practice for engagement with children and young people in the borough. This section is really important to help centre those who stand to benefit the most from long-term strategic planning, which is young people, at the forefront of built environment engagement. The guidelines, case studies, and resources in this section demonstrate how we can meaningfully engage, consult, and actively involve children and young people in issues regarding shaping the built environment. Young people are frequently perceived as being hard to reach. However, we feel the barriers they face accessing complex technical language and processes are entirely avoidable. And through the SBD, and particularly through this chapter, the Council's championing the voice of children and young people, promoting opportunities for them to be listened to, heard, and empowered to shape and influence their built environment. The final chapter of the SBD draft outlines the tools needed to inform and assess how development proposals can ensure children and young people's rights and specific needs are met in the built environment. And the one tool I'd like to draw your focus to in this presentation is the child-friendly design standard. The design standard supports a collaborative and inclusive approach and encourages different stakeholders to work together and use these statement sentences to address the impacts of plans and development proposals through the lens of children and young people's health and well-being. This draft tool is really important to ensure both positive benefits to health, inclusion, equity, and well-being are promoted, as well as to raise awareness of the potential unintended consequences of poor design and planning on the health of children and young people in our borough. Very finally, we propose that this design standard could be used at planning application stage, for example, by introducing a requirement for applicants to submit a child-friendly impact assessment when applying for planning permission for development of 10+ units. This standard could also be incorporated into and referenced in plan making through development of area-based plans such as Shoreditch, Dalston, Stamford Hill, this standard could be used through design review panels in our borough. So we suggest establishing a young people's design review panel. And finally, the design standard has been used for the upcoming Young People's Choice Awards for Hackney Design Awards. So yeah, as Lizzie mentioned, our consultation is open to the 12th of January. And you can have your say on our commonplace webpage, which is identified here. The Hackney Council planning website has a dedicated child-friendly webpage for more information, and you can also contact myself. My email is here. I'll hand back over to Lizzie.
Brilliant. Thanks very much, Gabby. I'll just keep it very brief at the end here, just to touch on sort of, I think there were some questions and key lines of sort of inquiry for the board. And I think in principle, just to say that, yeah, this is, the SPD is in draft form, and we would very much value feedback from the board, and particularly further recommendations on how design guidelines could be developed and to deliver health and wellbeing benefits, and also to understand opportunities for internal and external partnerships, and also to share the kind of consultation more widely. So I think I'll just end it there, but thank you very much for inviting us to update you on this.
Thank you both. I think we all really appreciate the presentation, and obviously given this past cabinet, I know that myself and cabinet colleagues fully endorse this piece of work, and I know Councillor Kennedy in his previous role was deeply involved. Councillor Woodley and Councillor Nicholson are not on the board, have been extremely active, and I know Deputy Mayor Bramble was one of the key co-sponsors and wants to comment now, but I think it's really probably for partners that haven't seen this before, members that haven't seen it before, to think about how they could be involved and contribute. And as Lizzie and Gabrielle have said about the way this interacts with health, and especially sort of public health and active travel and engagement, and those are critical early years. But Deputy Mayor Bramble, you want to make a comment?
Thank you, Mayor Glanville. It's been so interesting and so exciting and interesting to work on this piece of work with Councillor Woodley, and before that, Councillor Kennedy, and also yourself. And I think just some important things to say, no pressure with Councillor Williams with her equalities hat on in the virtual room, Mayor Glanville, but thinking about having that child-centred approach, what we also hope is that in the borough we also address the other protected characteristics for the other residents that we so want to champion in Hackney as well. And if you take it through that lens, we hope that we'll incorporate more of the community. And we use buzzwords about active travel, we talk about livable neighbourhoods, but actually what we're talking about, Mayor Glanville, is people, spaces and communities. And actually with the work we're doing with Child Friendly Boroughs just makes it a space where children just feel more confident to engage in their local communities, and that's why this work is so important. The last thing that I'll mention is the work of Children's Young Futures Commission. So when we spoke about young people being on the Planning Commission, this was a recommendation by the young people when we engage with them. I feel like I'm preaching to you, Mayor Glanville, because you were in lots of those meetings as well. Young people said they wanted to be involved in shaping their local community in terms of planning, and one of the things that they recommended is that young people were trained on the planning to be able to do that, and that's what's going on. So it's really, really good. So, but just thank you, Mayor Glanville, for championing such a good piece of work, and I know that you're proud of all your manifestos, but I know this one has a special place in your heart as well.
Thank you, Deputy Mayor Bramble. It certainly does. It certainly does when you open the, as I know we do, the London child-friendly city work as well, and see Hackney referenced so often.
And thank you to the staff as well. They are brilliant. They just make what Councillor Woodley and I do seem really straightforward and really simple. So thank you.
Mark, I know that you did have a 5 o'clock call, so apologies for not bringing you in sooner. Mark.
I've done a bit of jiggering pokery, so I might have to go for a shorter time later. Anyway, but just a couple of comments. Well, three really. One is to say how much, from my perspective, I welcome this and congratulate all concerned. It seems terrific. So thank you. A couple of other specifics. It'd be interesting to hear, because I'm not so familiar, obviously so familiar as you are with it, in terms of speaking a little bit more about provision for children who may be suffering with learning disabilities or potential physical disabilities that may or may not be enhanced or ameliorated by the environments you're talking about and shaping. So just having a little bit more to say about that, because I'm sure you've been very focused on that. And then also just a piece about safe away from cars, but of course so many people would either be on skateboards, scooters, motorized scooters, cycles, all of which could be hazardous to people who are playing and running around. I just wondered what you thought about those, because those are the things which we would encourage children to play and use and well, play and use, or even just get around the borough by using. And I wondered how that plays into the sort of safety issues around what you're talking about.
Thanks, Mark. Did anyone else have any questions or comments before I go back to the team? I cannot see any, so back to the team.
Oh, brilliant. Thank you. I just pick up on Mark, your second point first, just about the sort of safety issues around different kind of ways of travelling around. And I think one of the reasons that sometimes there can be a kind of conflict and challenges is that they're not planned for effectively enough maybe in the first place. And actually by kind of raising the awareness around child-friendly design and planning, then it means that those scooters, those other means of travel which are so important to children and their parents, which often cannot be sometimes considered in certain ways, are kind of actively planned for and thought about in terms of the spaces that are being designed and how they work. Yeah, and I think it's also that understanding, the kind of emphasis about understanding the place that you're designing for before as it's designed as well, and the very best place is kind of really focusing on that. And then Gabby, I don't know if you want to pick up on Mark's first point about
I just want to add also to the second point, Mark, thank you for your questions, is that I think we need to normalise seeing children and young people in spaces beyond playgrounds and play spaces, which is a point of this document. So yeah, I think that's something, a hurdle that I think everyone needs to address. And in terms of physical and learning difficulties and disabilities, there are specific guidelines throughout the document that refer to the needs of SEN needs and making sure that these are met within the built environment. So we have, sorry, there's so many design guidelines off the top of my head, I won't be able to reference them to you right now, but I could email you separately, or I could respond with them in particular. So we have quite a few guidelines referring to that. And we're working with our comms team to make sure that we have, we're trying very hard because of COVID-19, of course, a lot of our engagement strategies during public consultation has been limited to the virtual. So we welcome any connections you have to groups that you think would be happy to engage with us, that you feel fit within these, within the group you mentioned. And yeah.
Thank you. My request was to have a mechanism for, it may not be colleagues on the call, but to just make sure that strategy sort of comes back here as a sort of monitoring to see how well it's done against the objectives that have been set out. I think it's one of the ways that the Health and Wellbeing Board can stay in touch with this strategic work. So it doesn't, I think it's really important that we've brought these documents here and the next strategy, but we don't just want to be, as a Health and Wellbeing Board, a sort of tick box in an engagement exercise, but sort of that we can, and we're not a scrutiny commission, but that we do have that oversight of seeing the impact, and we're one of those forums for sort of onward monitoring. So it'd be great if we could have you or your successors back in a year or two's time, and just really welcome, I think, the progress that's been made, and look forward to hearing more about the consultation engagement as it flows out. I put the Commonplace consultation portal in the chat, but I think there is definitely resource here to go out and talk to groups and forums virtually, as has been said. So if there are places we should be doing that, and thank you, Amy, for saying that you're happy to help. So thank you. I'm going to move on because we're almost on track to the Hackney Parks and Green Spaces strategy. I think Sam's going to be introducing this, and there's a sort of 10 minutes split between presentation and discussion. And I'll hand over to you.
Thank you, Mayor. Can you see the presentation okay?
Yep.
Great. Thank you for inviting me to the board today. It's really exciting to be here introducing our new Parks and Green Spaces strategy, and we're really excited about delivering it from next year. As a bit of a background to the service, our service looks after 58 parks and green spaces in Hackney, and from next year we will also be responsible for around 200 housing green spaces as well. The new Parks and Green Spaces strategy will guide our work over the next 10 years and will cover both parks and housing green space. Given the uncertainty in the world at the moment, it's a high-level document with guiding principles rather than a series of specific improvement projects in specific parks. The draft strategy was written after extensive engagement with stakeholders at the beginning of this year, and we will be launching public consultation on it from next Monday, running through to mid-January 21. This is the first of many meetings that we're holding, seeking feedback on the strategy before it's formally adopted next year. Just to start with a little bit of context with other strategies. So you can see from this slide here, the highlighted boxes at the bottom show 3 pieces of interrelated work that are currently underway, and they're all looking at the future of green space in the borough. So the first element of this is a green infrastructure strategy that's being produced. Green infrastructure is classed in this strategy as Hackney's network of open space, wetlands, waterways, woodlands, street trees, gardens and public realm. So it includes green space in all its forms. The new green infrastructure strategy will provide an overarching framework to explain how Hackney's green infrastructure network should be protected, enhanced and expanded to make Hackney greener, healthier, wilder and more resilient. This particular piece of work is currently being led by ACOM, and ACOM previously worked with the GLA on a guide for all London boroughs on creating green infrastructure strategies. Underneath that, there is a local nature recovery plan, and this document's going to replace Hackney's biodiversity action plan in line with new government guidance. The local nature recovery plan is being delivered by London Wildlife Trust, and it focuses on restoring nature in Hackney, identifying existing habitats for wildlife and identifying ways of improving links between those habitats. So in the strategy, we've got a bit of background as to how we developed it. We started at the beginning of this year by speaking to a huge number of people who use our parks, partners, stakeholders and other organisations who deliver activities in our parks, including colleagues in the public health team. Luckily, this was pre-COVID, so we were able to have quite a few face-to-face workshops to help develop the strategy. The strategy has been designed to be relatively short, readable and accessible. We wanted to create a strategy that focuses on commitments and for it to be a document that the public can easily understand. So it's only 15 pages long, it's very visual, and we group our commitments under 3 main themes. So the first theme is working closer with our communities. Second, commitments under 3 main themes. So the first theme is working closer with our communities. Secondly, we want to activate our parks and green spaces. And thirdly, we're going to be more environmentally sustainable as a service. So starting looking at communities, we're blessed with hundreds of people that want to give something back to their community and their parks and green spaces. We actually noticed this summer during lockdown a huge upsurge in people wanting to help out looking after their local parks and green spaces because they were just so busy and had a real pounding this summer. We do have some existing volunteering programs in sites like Abney Park and Clissold, but we know that we could do an awful lot more. The volunteers that we interact with in park user groups are not always representative of the local community, and we need to work a lot harder to make them so. It's also not always obvious how people can get involved in their local park or green space, even if they wanted to. So we want to improve that publicity and communication with our communities. So just picking up some of the specific commitments around this, we want to improve the training that we offer our staff. We want to employ a dedicated volunteering officer and extend our work experience and apprenticeship program. Ideally, these 3 commitments would be linked. So we want to attract a diverse range of people to volunteer in our parks. Potentially some of those could then apply for our apprenticeship positions. And then those people would then be trained and upskilled into supervisor or park manager positions. The next theme that I mentioned is all around activation. So when we're speaking to people, there's a lot of people that think we could be doing more in our parks and green spaces to attract certain communities. We know that spending time in nature is good for our health, but there are sometimes barriers to people using our parks more often. We often ask people what would encourage people to spend more time in parks and green spaces, and they talk about activities to participate in, and they would like their local green space physically improved. So again, picking out some of the detail here for the commitments, we're committing to expanding the provision of activities in our parks and better prescribing activities to improve people's health. As part of the research that we did, we spoke to Islington Council, who recently got lottery funding to run a Parks for Health programme in partnership with Camden. And they're currently identifying organisations who are already running activities in the boroughs and encouraging those organisations to consider using parks and green spaces as venues to run those activities as an alternative to indoor locations. They're also looking to upskill their park keepers to potentially train park users in how to use equipment such as their outdoor gym equipment. We will not have a massively increased budget to deliver this strategy, so we need to consider ideas like this where we work with existing partners to deliver activities rather than putting lots of new activities on ourselves. There may also be a communication element to this. We know there's a huge amount going on in our parks currently, but it's not always clear to people what is happening or how people can get involved. So part of this process may involve collating information on everything that people are already delivering in parks and reviewing how best to publicise it to those who may benefit most from it. We're also looking at the provision of food growing on estates, increasing the number of food outlets in our parks, and reflecting the recommendations of the Ageing Well strategy. The third theme that I mentioned is all around sustainability. So we're looking to become more environmentally sustainable as a service. And these commitments fall under two categories, primarily responding to the climate emergency, but also to the biodiversity crisis. So again, looking at the detail here, looking at biodiversity, often it's the more natural spaces that have a more positive impact on people's mental well-being. So we're looking to increase the amount of biodiversity that we've got in our parks and green spaces in the form of tree planting, wildflower meadows, and other habitat creation. And lots of the detail for this will come from the local nature recovery plan that I mentioned earlier that's currently being put together. Some of you may be aware of the concern around pesticides, such as glyphosate that we use in parks and streets. So we're looking to reduce our use of such pesticides over the next 10 years. You might have heard of the no spray trial that we've got currently in Homerton, where we're not using any chemicals to control weeds in the street. And we're reviewing the impacts of that on our streets and pavements. We don't use as much glyphosate in our parks, but we're still investigating alternative weed control methods to reduce our reliance on chemicals. And finally, we'll follow the recommendations of the green infrastructure strategy that I mentioned earlier. And interestingly, both the local nature recovery plan and the green infrastructure strategy promote the concept of better connected green spaces. And some of you may be aware of Hackney's initiative called Connecting Green Spaces that seeks to improve the connectivity of all of our parks and green spaces. And that's something that was good to hear related to in the SPD talk previously. So we want to reimagine our parks not as isolated islands of green space, but an interconnected network of green spaces. Connected green spaces are fantastic for wildlife, but also encourage more active travel in the form of running, walking and cycling. And the 21st Century Street that's being piloted in Culverton Crescent at the moment is an example of how a wider public realm can be reimagined. And we want to explore the role that our parks and green spaces can play in that greening process. In summary then, we think that the proposed strategy will be hugely beneficial for people's health and well-being. We're seeking to increase people's skills, encourage people to use green spaces more regularly, and reduce the impact that the service has on the environment. The challenges we're going to face as a service going forward are linked to the increasing population of Hackney and the increasing popularity of our parks and green spaces. And if any of you were in them this summer, you will have seen just how popular they are becoming. If our parks become too well used, they will potentially put some people off using them. And we've seen very popular sites like London Fields having a negative impact on some of the nearby community. Hopefully by investing in improving parks across the borough, we will reduce the pressure on popular parks like London Fields and Clissold Park. And that's the thrust of projects that we're currently undertaking in sites like Abney Park and Springfield Park, which have traditionally been less well used than some of our other green spaces. Streets like The 21st Century Street in Colston Crescent will also potentially encourage people to use the whole borough to play and exercise, providing multiple opportunities for people to improve their health. Again, linking back to what was said previously about the child-friendly SPD. So once the strategy is adopted next year, we will produce annual plans that will give a bit more detail on how each of the commitments will be delivered, and we will publish an annual report that will identify the progress against each of the commitments. We started the process of planning the detail in the background, but the consultation at this stage focuses on the higher level commitments in the strategy itself. We'll be consulting on strategy from next Monday. We're going to Cabinet in March, April next year, and hope to start implementing the strategy next spring. So that's a very whistle-stop tour of the strategy, which the public will be able to comment on from Monday. But it'd be really useful to know if you've got any questions about the draft version or any additional areas we may want to consider. So I'll open it up to questions.
Thanks, Sam. If you can stop sharing the screen, that'd be great. And I've got Malcolm and then Sandra. Malcolm.
Okay, that's a fantastic strategy. Just want to ask you one thing. Clissold Park can sometimes be quite dangerous with cyclists going very, very fast, and which is a real threat to people who are disabled, older people, and I know some people keep away from the park because they find it too unsafe down the pathways. How do you deal with that kind of contradiction between, you know, wanting to include everybody's needs and yet some people perhaps being excluded because of others' needs?
Yeah, it's something that we do occasionally get correspondence from the public about. As a general policy, we allow cycling in all of our parks and we encourage it because it promotes active travel and it's good for the environment. But certainly there are particular routes through our parks which, as you highlighted, do cause concerns for people. London Fields is probably the prime example where we've got most correspondence. So we've created a few initiatives there in recent years. You might have seen the signs that light up when people are going too fast. We put rumble strips across the path. We put different coloured surfacing, encouraging cyclists to slow down. And we've put signs at the entrances, again, asking cyclists to slow down, and the fact that pedestrians always have priorities in our parks. So where we do hear about particularly fast cyclists and particular routes, we do look at measures like that. And we have had targeted campaigns in the past where we have that signage and we have people going out encouraging people to slow down.
Thank you very much.
Thanks, Sam. Sandra.
Thanks. Thank you, Chair. Thank you, Sam. This is really welcome strategy, and very excited to see it. I just there's a lot in it. There's a lot that I could comment on, and perhaps it would be a good idea to come back and talk to public health again when you get into the implementation phase. But one of the particular things I wanted to ask about was re-greening, which I wasn't really clear whether that was part of the strategy. I think that would be a missed opportunity if it's not in there, and it might have been just that I missed it. So if there's an opportunity to create more green spaces, more parks, or whether it's just around the developing on the the new street containers and things like that, and how we can use those to increase biodiversity and get people involved, local people involved in planting and looking after the environment as much as the places that they can go and sit and play.
Yeah, so our remit as a service at the moment is just the 58 parks that we look after. From next year, that will include around 200 housing green spaces, but our remit does not cover the street or the hard bits of land in between parks and green spaces. However, the Connecting Green Spaces initiative that I mentioned and the Green Infrastructure Strategy are both looking at those areas, looking at where we can potentially do more re-greening. The 21st Century Street is an example of that. So we're working closely with Regen, with our colleagues in Street Scene to make sure that our green spaces connect up to those initiatives where they're happening. So from a parks and green spaces point of view, we're looking at widening our entrances onto those public realm areas and looking at whether our parks and green spaces can almost spill out into the public realm to create those connections. So yes, it's happening, and we're working with colleagues to deliver that. Yeah.
And I think before bringing Catal, there's quite a lot there in some of the co-design work at Shoreditch already. But you mentioned, Sam, the work about ageing well. That confidence to go out and be able to take those moments in the shade, benches that came back, access to public toilets, access to water, those sorts of things that can be barriers to feeling confident in those spaces. So I think there's some really exciting things happening there. Councillor Williams.
Hi Sam, this is it's a really great piece of work and lots of thought already got into it, so I'm not going to repeat what everyone else has said, but there were just two things that I wanted to pick up on, and that is volunteer, and I'm hoping that at some point as a cabinet we can come back in more detail, but immediately I just wanted to pick up on volunteering and apprenticeships, and of course you'd expect me to pick up on both those two, and I'd really welcome a further conversation about those and how we can work with the park service. And as I say with everyone, you have a long way to go before you can reach the heady heights of the ICT department, who've got the most amount of apprentices, but any service that wants to deliver an apprenticeship, local apprenticeship placements, welcome that. I really hope that you've already been speaking to the apprenticeship team, who are doing some excellent work with our apprentices so far.
Yeah, we've not had any apprentices in the service for some time. We're looking to get some as part of the Springfield Park Heritage Lottery funded project from next year, but this strategy is definitely committing to expanding that an awful lot more and looking at opportunities to get more training for young people, because there are a lot of young people that want to be working outdoors. They're not necessarily interested in working behind a computer screen. So to some young people, this is a really attractive line of work if they can only get into it.
Thank you. What I wanted to sort of expand on, and I sort of probe, I guess, from a health and wellbeing board perspective and some of the partners here. The imitation is a good form. The PCNs, the neighbourhoods, are obviously named after our parks, which is a really great piece of kind of warm place capturing about what we're trying to achieve. And you reference animating our parks and more sorts of events. And I know that the sort of forest school methodology around adventure playgrounds and using green space to kind of teach and encourage well-being and engagement with nature, just what the work, the co-production might happen further into the strategy around how health partners, social prescribing, VCS organisations can access and animate in activities around that for a wider cohort of people. So we obviously have things like the New Age Games and other activities, but at the moment that can feel quite commercial and quite professional sport, and just those opportunities that we might have to promote those sorts of activities, and I guess break down some of the barriers about what might be involved in putting on an event. And there's obviously that balance between income, cost of events, and accessibility.
Yeah, absolutely. And this came through quite strongly when we were speaking to local people. When they had wanted to put activities and events on in the past, they had found the process quite difficult to navigate, quite bureaucratic. So as part of the strategy, we're committing to making that process a lot clearer for local communities and looking to explain the process and help people who want to put those sorts of activities on, sort of guiding them through that process. But I think I mentioned earlier as well, a big part of this is going to be about communication. You mentioned the New Age Games, and there's all sorts of other fantastic things that are going on, but lots of people don't know about them. So a big part of this is going to be a big audit of everything that's taking place and identifying who needs to know about those activities and kind of linking people up without those activities that will most benefit them. So it's going to be a major process, but we want as much input from people who are keen to put activities on as possible there.
Thank you. Great. I can't see anyone else indicating it. I think, as I said to planning colleagues, and given you mentioned the action plan and the timeline later next year, it'd be great if you could come back and also maybe report back on some of the collaborations that hopefully will come from this discussion. But obviously it has a huge impact on health and wellbeing, and I think the two strategies that we've seen, thinking about Kings Park moving together and other work that's happening in the borough and how these things fit together, is a really exciting and something that the board would welcome continue to be involved in. So thank you, Sam. I'm going to hand over to Dr. Adi Cooper and item 12, the City and Hackney Safeguarding Adults Annual Report and Strategy. It's something that I know we've already approved at Cabinet and had a discussion this week strategically, but it's also good to see it obviously here and allow a wider range of partners to input.
Thank you. Hopefully I'm coming through clearly. Introduce myself, I'm Dr. Adi Cooper. I'm the independent chair of the City and Hackney Health and Wellbeing Board. And what you have today is two documents. You have our annual report. So it is a statutory requirement of the board to produce an annual report. And you've got the report for last year. So this was 2019 to 2020. But also it's a requirement to have a strategy, and our strategy had expired. So one of the key things we did during last year was consult on a new strategy. And you've got the revised strategy, which will frame, it's quite high level, it will frame what we do over the next 5 years. So the report covers the usual areas. It shows the incidence of safeguarding risks and abuse in the area. I have to say the pattern of what we see in Hackney is fairly typical to a national pattern. It describes what we achieved last year. There are 2 safeguarding adult reviews that were published during last year. So these are reviews that unfortunately people die where there are issues where we can learn to improve services, coordination. One was the death of a woman called Jojo, who had a learning disability, and there's been a huge amount of learning from that review. And there was also another review that we did with some other boroughs about a man who was homeless, Mr. Yee, and some colleagues may be aware that we're currently undertaking another safeguarding review around a homeless person who died in Stoke Newington last summer. I would say that already the board had a focus on homelessness and rough sleeping, and there's been a task and finish group in the City and Hackney board that predates both these deaths. So this was an area that we were looking at already to seek to improve work, but unfortunately the safeguarding adult reviews have exposed areas that require different work and improvement. I have a really big focus and emphasis on involvement and prevention activity and raising awareness. It's one of the core duties of the board, and I'm pleased to say that last year we trained some more safeguarding champions, because it's really important that people are able to go out into communities that they belong to and support people to raise awareness of safeguarding adults and the work that needs to be done, and the support that people need who are vulnerable in our community. We've done quite a lot of work on improving our communications more generally, so a newsletter that goes to members of the public, and we are engaging, I think, better than we ever have done before with different communities and members of the public, and also co-produced work with groups of service users, people with experience of using services, that I think has really benefited what we've been able to achieve in Hackney and the city. I'm very pleased to talk about the transitional safeguarding group work, which I lead on behalf of a joint venture really between us, the Community Safety Partnership, and the Children's Partnership. And I think that's been also a feature of the work that we've been doing, is not seeing adult safeguarding as somehow so discrete and isolated, but working across those boundaries of responsibilities between different partnerships to try and improve, particularly in this case, the potential cliff edge that comes between children in transition from childhood into adulthood, and the different ways in which safeguarding duties and responsibilities apply, and how some young people unfortunately fall through those cracks. I think it would be remiss of me to not mention COVID, not least because of the first presentation that you had this evening, and we did briefly touch on this in the annual report, because we were drafting it as the lockdown commenced earlier on this year. as I said, I think earlier this week in the Cabinet, I think the response in City and Hackney to have an executive group meet regularly to ensure that all partners on the board are taking their safeguarding responsibilities seriously and continuing to meet their duties despite or because of the potential complexities of the impact that COVID has had on people's lives, and in particular on safeguarding activity. And I suppose I'll just end up by saying one of the main requirements but also the main reasons why we undertake safeguarding adult reviews is to learn. We have also been trying to learn from the pandemic what impact that had in terms of safeguarding and what we might need to do differently as the pandemic continues. So next week is Adult Safeguarding Awareness Week, and we're hoping to publish a leaflet for the public, which is based on what we found looking at cases of safeguarding activity during the pandemic and some specific issues that we identified were related to experiences of the pandemic, to try and nudge people to maybe behave a bit differently as the pandemic continues in terms of avoiding, managing, dealing with, responding to some of the risks that have arisen that are maybe new and different or have changed due to the circumstances in which we're now living in the pandemic and second lockdown. So I think if it's okay, I can end at that point. I'm very happy to answer questions, and there are actually colleagues on this in this meeting who are members of the board who can also, I'm very happy for them to contribute if they think there's anything significant that I've missed out in my brief overview.
Thank you. That's really helpful. Questions or comments?
Shall I respond to the comment?
Yeah, so Jake, do you want to just ask the context, obviously, in the chat, but just for people that might not be able to see the chat who are accessing through different devices, and I suppose this is also a transition point, isn't it?
Yeah, I think it is.
But Jake,
do you want to?
I didn't know if I could ask formal questions as I'm not a board member, but I'll take the opportunity anyway. So some people will know there's an IOPC investigation into an incident a month ago at Ferry Lane where a young Hackney black young man who hasn't been named as yet entered the water following police contact, and unfortunately didn't come out. Obviously it's an ongoing investigation, but I think it's symptomatic of the mistreatment by Hackney police and Met Wide of black young people. And some of you may have seen the report that the young people have produced, the people in the account group. And I think many of the young people feel that their mistreatment at the hands of the police is a safeguarding matter, but they feel that the safeguarding board or safeguarding agencies don't really hold the Met to account. I think when you look at young people under 18 and particularly under 16 who are being routinely stop and search, that for me, I mean, I'll put it bluntly, feels like child abuse. And I just feel that the board isn't doing enough to hold the Met to account on this.
Anne wants to comment. I would just mention that we have a joint piece of work going on around transitional safeguarding, and a number of these issues have been discussed within that group and are featuring in the work that we're doing within that group. And I suppose as an adult safeguarding board chair, sort of legally the responsibilities of the adult safeguarding board start when someone reaches 18. So I'll comment on it from an adult safeguarding perspective really, and say that it is an area of concern. It has been raised, and indeed when we had our last safeguarding adults board meeting and talked about the work of the transitional safeguarding group, there were visitors to the board who raised similar points. So I suppose the first thing is to say is that those issues are being raised and are being heard. What we then do with that as a piece of development work across the boards is not just for me, but it's for all of us, I suppose, to decide. To be quite specific, the police were put on the spot, and I don't think as the independent chair they really addressed it very well at all. I think there are other people who can comment. The transitional safeguarding piece of work is where I think those issues can be taken forward in a far more productive way. But I think if I can hand over to Anne Canning, maybe that would be helpful at this point.
Thank you.
Thanks.
Yeah, thanks, Phil. I just wanted to make a point, Jake, and there were others on the meeting with me yesterday. We had this Safer Young Hackney board, and this item came up, and unfortunately through connection problems, our police colleague wasn't able to join us, but I made a commitment that I would go back and we would bring this issue back in the new year. And in particular, around the support across the system that's given to those 80% of the stop and searches for the young people. I think that, I don't know actually, I can't remember if it covered all ages, but certainly the large number of those stop and searches which aren't what they consider successful, and actually the impact of that on the young people. So there was quite a strong voice in the group yesterday to follow it up, which I will do, and I just wanted to let you know that, Jake, and I'm happy to speak to you offline about it.
Thanks, Anne, and thanks, Adi. I mean, just so you know, I mean, the officers involved in the incident were local robbery officers, and they're still on, haven't been suspended, haven't been taken off or put on restricted duties. I just find that very weird, given in the rest of us, if we were involved in an unfortunate incident where somebody died as a result of our contact with them, we'd be suspended immediately. And I think the Met just follows its own rules. And I think until they are prepared to make and follow the same principles of engagement with communities as everyone else is, we have a real problem. I mean, unfortunately, I don't think Marcus is on the call. He's not well at the minute. But this is really serious. And I think unless the board really seriously holds the Met to account, we're going to be having these same conversations for the next 10, 15, 20 years. I don't see any change.
Do we have, within that transition work between the two boards, have account presented to that group? Has that interface kind of happened, making sure the sort of voice of young people is sort of heard at that place? I know that there's extensive work happening across the council and the partnership to deal with some of the issues that Jake is very legitimately raising, and I think there's also a follow-up Haringey and Hackney stakeholder meeting that the IOPC are planning imminently. I haven't got the date in front of me, but I just wonder, just in terms of where that transition work is kind of happening. And I guess what Jake is seeking, I guess, is that the independence that the boards have of both the council and the system, in a sense.
So can I thank you for raising that, and I think that is the place where this is being followed up. And I suppose the work, to summarise very briefly, the work of the Transitional Safeguarding Task and Finish Group has been to gather quite a lot of information, to look at what initiatives are already going on and to try and shape what might happen next. And the critical focus of the next phase of work is to do much more engagement with young people in co-designing or co-producing whatever may come out of that group, because there is absolutely no point, in my view, trying to make proposals for something around transitional safeguarding without young people being directly involved in steering what's going to work from them. And it would be fair to say that in Hackney, one of the reasons this work is probably further developed than elsewhere is because there's a history of the contextual safeguarding work that has been taken through the Children's Safeguarding Board partnership work, and so we're coming to this from a quite different place. So where we are now, Mayor, precisely is that point of trying to engage with, but not duplicate, because obviously that's not helpful, consultation and engagement work with young people in order to shape where we go. And I suppose to reassure Jake, not just the death of the unfortunate circumstances of the death of this young man, but even before that, the Black Lives Matter campaigning that has been going on earlier on this year has meant that within the transitional safeguarding group, there's already been a focus on a whole range of issues that maybe if we were to do this work 2 years ago may not have been so centre stage. So it is on the agenda, but this current stage of the work is to do more engagement and consultation, and that's the piece that I'm now taking, because I'm fronting it on behalf of other colleagues, to the different boards to say this is where we're at, this is what we want to do next. And I'm shortly to go to the Children's Partnership to talk to them about this, and so I imagine and I suspect that this will be raised in that context, and if it isn't, I'm happy to continue to ensure that I suppose it's part of that agenda, because I do think that it does sit there to some extent. I mean, it needs to be addressed through that work as well, if that makes sense.
Yeah. Thank you. That's a really helpful direction of travel that you set out there. Are there any other questions here? And I wonder, I'll put you on the spot, Adi, if you had anything for us, kind of given the range of partners here, anything that you wanted to sort of highlight that you wanted us to be more involved in, certainly in terms of the strategy?
That would be it, Mayor, actually, Chair. I suppose for me, safeguarding adults can often be seen as a quite niche and specialist area, and it's not. It's underlying even the contribution just now about parks and public spaces. There are safeguarding adult risks around those areas as much as there are in a care home, to be quite kind of blunt and slight caricature. So I suppose my plea to the board and in the work that you do is that safeguarding adults and the risks for vulnerable adults in particular are addressed at a strategic level in the various strategies that you address and look at through these processes. And I'm very happy as chair, as an independent chair of the board, for the adults boards, if there are items that should come through to the board or require some sort of linkaging to make that happen. And Raina, who's the board manager, is in the call. She's answered a comment at the chat, and we're very happy to pick up issues that may at the surface not appear to be particularly key safeguarding adult issues, but because of some of the implications around risk and vulnerabilities for different groups within the community may well be. So that broader prevention agenda is as important as the protection aspect of safeguarding work, if that makes sense.
Yeah, that's really helpful. Okay, I think that's that item. I'm really welcome seeing you 3 times in almost as many weeks and discussing these issues. They're really important, and I said in the informal meeting earlier in the week, we do need to make sure that we take adult safeguarding collectively as seriously as we take the safeguarding of young people. I think we're certainly well on our way to doing that, and that's obviously due to your work, but obviously making sure that all the partners agree with what you just said. So I really do appreciate that. I think that is broadly it. In terms of the questions from members of the public, it was just to highlight to all of our networks that the opportunity to raise questions exists at the Health and Wellbeing Board. We promoted that through social media just over a week or so, but obviously there are networks. I know that there's also the community voice section, so making sure the board is permeable and engaging is really, really important. I know that's something that we're all working towards. So please do promote that. There is a process for doing that, I think, in the agenda pack. Peter, did you want to add anything to that?
Just to say that the procedure is attached to the report.
Thank you. I haven't been notified of any AAB. We've got another meeting on the 28th of January. So we're on a bi-monthly cycle, which I think is really positive in terms of maintaining momentum. And I've been talking with Mark just about shaping the board agendas and ensuring, and I suppose this is a plea to non-council attendees thinking about strategic documents that you would like to bring here, that would have a place here. I really welcome Healthwatch's contribution and the way that the board responded to that and the partners responded to that outside the meeting. I'm certainly really interested in the sort of pioneering work happening within ELF and the Homerton and the CCG. So if there's a good topic that we can bring here for discussion, not replicating what happens at the ICB or scrutiny, but this is a really good opportunity to get that wider input to strategic development going forward. Does anyone? I'd rather be notified of AOB than have it sprung on me, but there is in theory 5 minutes left. I don't expect us to use them all, but is there anything else anyone wanted to add?
Hi Phil, can I jump in right at the end?
Yeah.
I wasn't sure if I was meant to be speaking about the VCS resilience paper, which is in everyone's packs. Just to say that we are hosting an event next Wednesday for the voluntary sector about the impact on them of the second lockdown. So that'll be an opportunity to test whether there are any new emerging needs that we weren't currently aware of. And thanks to the Mayor and colleagues for agreeing to attend that. We're also going to host a launch event for the resilience paper on the 30th of this month, which again will allow us to drill down into the detail of the voluntary sector's response. So I can come back to the board at another time with an update.
Thanks, Jay. Really, really helpful. Really looking forward to next week. And none of us can forget the enormous contribution that the voluntary sector have made during the first lockdown, in the intervening period, especially around poverty and outreach, the work that you're doing in public health, and then obviously what you've indicated. So I'm looking forward to it, and I hope colleagues do engage with the strategic paper and continue to engage. And I think across all of our work streams, the voluntary sector is incredibly, incredibly important. Thank you. Well, thanks all. The co-chair will pass back over to Dr. Ricketts for the January meeting, and we look forward to be under his august stewardship in the new year. No doubt we will see you all in other forums before then. Thank you.
Phil. Thanks, Phil.
Thank you.